excited to bring you another video for the Motherhood Grace Village, and this video is about mental health. So I want to do a brief introduction, not only for our guests, but a bit about how mental health ties into this whole community. If you don't know the background, I had a rough postpartum period suffering with postpartum anxiety and depression, and really when I was trying to figure out the guide, it started as how can I just help all moms with mental health through this transition, because I believe that any mother makes it through without any type of hiccup in the mental health department. Whether it's just even a day or moments, I think we all need to learn how to support our mental health and kind of realize what's normal, what's not normal in the postpartum phase, or even when do I get help? What does help look like? All of those types of questions. I really want this community to be that support that you need, especially with your mental health. Not only for the questions like, what diapers do you like the best? Or my kid won't sleep. How'd you get your kid to sleep? Those questions are all valid and welcome here, but I really want to focus on mom and how we can support you as mom through this journey, especially in your mental health department. So I invited Shelby Leppin to come on and do an interview, a video interview with me. So I wanted to do these videos so that you feel like you're just kind of sitting down and talking with some girlfriends. I love Shelby's energy. So she's such a calming presence, and I just love talking with her every time that I do. So she is a psychiatric mental health nurse practitioner. So she is a nurse first, and then she specializes in mental health, as you'll hear her clarify in the video today. She provides medication management and mental health services for patients with depression, anxiety, bipolar, schizophrenia, and other psychiatric disorders. Shelby currently works at Preferred Family Healthcare in Kirksville, Missouri. So if you are in that area, I hope that you can reach out to Shelby and possibly connect with her, because I know that you are going to really love her. Just on a personal note, Shelby has 5 kids. That's crazy. Every time I talk to her, I'm like, I am just in awe of you, because I think that's wild. 4 of them are actually foster children that they have adopted, and then one is one for between her and her husband. So I just know that she's such a wonderful, caring, and conscious parent, and that's why I really wanted to chat with her, especially at the beginning of this group. So I hope you all enjoy this video and topic. Just so you know, I did say to her, sometimes this is such a deep topic, and did I really want to talk about things that were so heavy? And she said, that just kind of still plays into that stigma and taboo of not talking about mental health. So we do go through and we talk about postpartum depression, anxiety, psychosis a bit, and touch upon a bit of the symptoms, when should you seek help, and using Shelby's clinical expertise in this area. So I hope you really enjoy this video. Of course, comment below to continue the conversation, or reach out to Shelby or I. I am going to include links to all of her information, and you can reach out to her as well. Enjoy the video. Okay, so we're here with, I guess, my mental health expert, as I kind of listed you when I was going through and talk about the women that I wanted to talk to. This is one of I'm going to call you a friend. I feel like we've become friends now over the years. Shelby Leppin, that's how you say your last name?
Yes.
I always butcher it, but I'm like, I know that's how you say it, but I still want to butcher it. How are you?
I'm good. How are you?
I'm good. So why don't you just tell everybody a little bit about yourself? And I mean, they're all just going to love you because you're such a calming presence. I love talking to you.
So yes, my name's Shelby. I'm a mental health nurse practitioner. Essentially what that means is I have my master's in nursing, but my focus is primarily just in mental health. So I love really helping people find a holistic way to manage their mental health symptoms, because I think a lot of anxiety and depression, I think there's root causes for a lot of that. And I say holistic in the sense of I use medication, I use traditional Western therapies, but I also really look at diet and spirituality and emotional health and just different layers. And I really try to set it up to where I'm helping people wherever they're at. Because if I go into a session with my own agenda, it's not going to be helpful. Like, a key component, I think, of mental health is just meeting people where they're at and helping them figure out, okay, what can I do next, or where can I go from here? Because most of the time when people come to see me, they're so overwhelmed that it's like, if you give them a list of things, it just doesn't work very well. So that's kind of my passion is, okay, if you're in this place, I'm going to help you get to this place, wherever that may be.
Like stepping stones.
Yes.
I think that's awesome because a lot of times I think people just want, like, all of us, I'm using us as like consumers, like we want the quick fix, or we want like, just give me the thing. But what you're saying is like, but you're right here, and that thing might be when you need to be at step 6, not when you're at step 1. And I almost look at like my postpartum journey and I think about it that way, because I didn't start going to therapy until I was about 5 weeks or 5 months in. But I almost wonder, like, I think that was like the time that I needed to go, because I learned so many lessons in those 5 months. And I had such a kind of crash, I guess, that I had to almost hit that to really understand the things that I needed to work through for myself. And I try not to use that like everything happens for a reason phrase, but it was just like, it played out the way that it was supposed to, despite how hard it was when you're going through it.
Right. And everyone has to hit that point of like where you're willing to receive help, because there's such a stigma still around mental health and getting help. I see people all the time who I'll talk about a medication and they'll be like, oh my gosh, no. And it just scares them. And that's okay. And
It's
I
still
tell
me.
them,
I mean, I'll just be transparent with you.
yeah,
That was still me. And even when I resisted going to therapy for so long, or seeking help, because I was like, they're just going to put me on medicine. Like, and is motherhood this hard for me that I have to go on medicine? Like, I wasn't mature enough around the topic to really understand it. And that's why, especially, I want you in this group, because I want new moms, and maybe even if you're a mom of a toddler, like, to just hear about like your whole approach. And sometimes medicine is in that. And I was actually even interviewed for a podcast yesterday where I said, holistic to me doesn't mean that like I never use medicine, or I'm 100% hippy dippy, crunchy, whatever the words are anymore. I said, it's just that I can zoom out and look at the whole picture and not just focus on one piece of the pie. It's the whole pie. And if, this piece is really suffering, I need to like take a step back and maybe take from other pieces and figure out how does it all go together.
Exactly. And I will say, like, medication isn't the answer for everything.
Right.
But there's times where I think if you look at the costs and the benefits, the cost is really high. And there's women who experience what's called postpartum psychosis, not to scare anyone, but like depression in the postpartum period is serious. And if it continues untreated, things can get really bad. And so there really needs to be a discussion where it's okay if you need help. That doesn't mean you're going to need to be on meds the rest of your life. That doesn't mean that we can't work on therapy and diet and all these other things to provide you support to help you get through this. But I mean, I always use this example. If the house is on fire, like, you need to put the fire out. Then when the fire's out, then you can rebuild and start to fix things from the ground up. And that's where diet and therapy and stress management and all those things come into play.
It's so true. It's, I know I've always heard Diane, my mentor, talk about like what's burning. You have to fix the most serious problem before you can take care of anything else. And that's why people always say you have to take care of yourself before you can take care of the little one. And I never really understood that until I had the kid, and I was so severely not taking care of myself that I was like, I am not showing up for like any thing right now, myself, my baby, or my husband, anyone. Nobody is getting my best self. I don't know if she exists at this moment, and so, like I said, it was crashing and burning until I could take a step back. And now I'm like, okay, I feel like I'm redeeming myself in some way by trying to put this into the world. At least it feels better in my mind. So let's just like maybe talk about like mental health postpartum there, because we do have, and I should have grabbed the book. I did have like a small glossary, because someone said is like this just for postpartum depression or anxiety, and it's not. It's just supposed to like support mental health. But I definitely bring up the topics of like postpartum depression and anxiety and like letting people know what they are. But let's just start with like postpartum, the postpartum period. Is there anything that like really happens to like our brains, or is it just like a harder period because we're not sleeping? Like, what should we really expect in that period?
Okay, so immediately after you give birth, your hormone levels immediately drop. Now, people have different responses to that. Some people, I've seen moms who like a week later, they're up walking around, they look great, like everything's put together. I was not like that. Oh my
I
gosh.
was
Like
not like that. I
I
was a
had a
crying mess.
very intense postpartum period. It was very intense. And so my emotions were up and down, my anxiety was up and down. And so I think it's a combination of like physically, there's a lot of changes going on, but externally, there's also a lot of stressors going on, and they're not bad stressors. I think sometimes we think if you struggle, that means you don't care about your baby or that means you aren't a
Totally. Yes.
mom. It's like, that's not true.
Hmm.
Like, they're separate issues. You can love your child and still be anxious and depressed and just not in a good space. So I really think the guilt and the shame needs to be taken out of the equation in order to objectively look at what's going on during this time. Your body's stressed. You have the fluid level in your body drops dramatically. So a lot of times people have blood loss, which leads to anemia, which leads to fatigue, and then you're not sleeping on top of it, and then your hormone levels are dropping and you're trying to find a new balance and rebound, and you just burned a bajillion calories
Every calorie you
pushing
have in
out
your
this
body.
child. Yes, like I remember when I got to the point that it was time to like push and get him out, I was like, he's coming because I can't do this any longer.
Yeah.
It
Like,
was like, I'm done. I'm getting up. And I literally, like, I stood up and was like, okay, I'm doing this. And my midwives were like, you could like hold off a minute and I think it'd be easier. And I was like, sorry, no, like
no.
he's coming now because I can't do this anymore because I
It's
am
kind of like the
so
end of
tired.
pregnancy, right? You're like, I
Yes.
can't walk with this being in my body anymore. So they
Mhm.
need to come out. Like, I don't care. Because I remember being so afraid of childbirth. And I was like, I don't care how she comes out. She's just coming out. Like, and
Right.
my kid was small. So, like,
Yes. And we all get to that point of like the pain of staying put is worse than the pain of pushing forward. And that's what you have to do. I was thinking about it in preparation for our discussion. And I think I'm changing my like personal recommendations for what I call baby blues versus postpartum depression. And I
yes,
have a reason for this that I'll explain.
definitely talk about this because I actually, somebody just messaged me about like baby blues and being told what she was experiencing was just baby blues. And so I feel like that's like a very common thing. So we definitely need to jump into this.
Yeah, I think if you look at the technical definitions, there's there's kind of disagreement on like what's normal versus what's not normal. And this is just as a clinician and a mom, this is the guidelines that I go by for myself and my patients. If you have more than 3 days of feeling depressed and down and really anxious, you need to get help. Sure, you might not technically meet the criteria, but a lot of times it takes a long time to get in to see someone and actually get the help
True.
you need.
Mhm.
So if you wait, you're going to be in, it's going to get really, really bad. Does that make
Right.
sense? So
Yeah.
in my opinion, if you have more than 3 days of, and I'm not talking like you're just tired or worn out or just kind of blah, a little of that is normal. I'm talking you are depressed, you're crying all the time, you're so anxious, like it's hard to get through the day.
Hmm.
Warning bells, you need to get help. Okay.
So
Because
what are you calling, so you're not putting on the like 2 weeks or the like that time? Because I feel like that's what I usually see with baby blues. Like, oh, if it's in the first 2 weeks, like, you're fine. It's just the baby blues. So you're
right.
just saying 3 days, if you're feeling that bad for 3 days in a row, I don't care when it is, but you need to go talk to somebody.
Yes.
Okay.
And again, my reason for that of like, yes, that doesn't meet the diagnostic criteria, but my reasoning is it takes so long sometimes to get help that even after 3 days, if you get help right away, it might take another week or two before you can get into
It's
symptoms.
totally true. Or you walk in and like almost every, I mean, I've only gone to like 2 different therapists at this point, but each one, the first meeting was just like going through a form. You know, it wasn't really
Right.
actually getting into anything.
Right, exactly. And so that's why I really think a lot of this, the postpartum period, it goes undiagnosed and it gets missed. And I think we need to catch it sooner because it's going to help babies and it's going to help mamas, and we're going to have better outcomes if we
Now
get on
I
the
wish
right
we had
path.
this discussion before I printed anything. This is
But again,
why
but
this
this,
is why I did a small run so I could go back and like add things in as like I learned about
right.
learned
But
more.
again, this isn't the technical
Technical, right?
diagnostic guidelines that you'll find. This is just working with people in my own personal experience
But
of,
here's also like my thought on this, like why not?
right, like why'd you have to suffer for 2 weeks before you
Right.
get permission to get
Like
help?
why, like to me, even being like a doctor or whomever is saying this, like if some woman is coming to you and telling you that she needs help, why are we not helping her? Right?
Right,
I just don't
exactly.
get it. I
Mhm.
mean, it has to be lack of resources and different things like that. So that's like why I wrote this, because I was like, we like there has to be a gap. There has to be something we can give people, or you know, like just something. But
Mhm.
yeah. Okay, sorry, I keep interrupting you.
No, you're totally fine. I think, and we've talked about this before. I think this was your idea, and I'm going to repeat it. In an ideal world, every woman would be assigned a therapist like right when they get pregnant. Do you know
Hmm.
what I mean? And they would
Yeah.
have it throughout the whole process, and then in the postpartum period. For me, I had a counselor before, and I had done a lot of counseling prior, which I think is a big key factor into why during my postpartum period, I had a lot more coping skills than I think I
Yeah.
would have otherwise. Because I just, when I say intense therapy, like I was going a couple times a month for like 6 to 8 months. Like it
Yeah.
was a lot, but I had a lot I had to work through. You know what I mean?
Same.
So when we got to the postpartum period, oh my gosh, it was intense. And like physically, I had some stuff going on that made me more anxious and more just on edge.
Hmm.
And I think, ironically, if I were to do it again, I would make sure that I have help for longer. Like I set it up to where I had like my mom or my mother-in-law there for like the first 2 weeks after I had him. If I do it again, I'm going to have help for like the first month
Yep.
because I just, it's so much all at
It
once.
rocks. It totally rocks anything that you ever did before. Like your whole life has changed. Like you think your life changes. Maybe when you go to college, you're like, oh, I've never been to college before. But like you've been to school and you've been around friends. And like this is just like you are now responsible for this human. Like,
Mhm.
and they don't
Yeah.
go away.
No, there's not an off button.
No,
It's not
there's
like in high
not the
school, there was those
school
fake
baby where you
papers.
could take the key out. Like you can't just say, "Oh, leave it cry in the corner and get a B on my thing." We never did that, but like I've always seen it in the movies. But yeah, it was just like I remember at one point being like, "What did I just do to my
Mhm.
life?" Like, I
Right.
just like I felt so, and I think every mom kind of feels that in some capacity. Whether like, I don't know that I necessarily like loved my life before that, like you know, and I know that there are definitely people who are and who say, I don't want to have a baby. I love my life as it is. But it was just like, holy cow, this is so different than what I did before.
Right. Well, and the other thing that I wish people would have told me, just as a mom, is that the newborn period is intense, but it doesn't last forever.
Yes, right.
Like having a toddler now has been so much fun for me because as a mom, like the newborn phase, he just like he literally, I couldn't put him down for the first like 8 months of his life.
But you know what? Do you know how common? I feel like every mom I've talked to, it's like, I couldn't put my baby down. I'm like, okay, so where are these babies that can be put down? Because
Right.
to this point, I haven't really heard of a baby that's like happy go lucky just sitting there by themselves. Like they all want to
Right.
be held and with their mom.
Right. And it wasn't, I mean, it wasn't that he was doing anything wrong. It just like,
It's just a lot.
it is, it's a lot.
Like
And
if my
so,
husband came home, I'm like, do not touch me. I've touched somebody else all day long.
exactly. Yeah. I just think
Sorry.
you want your body back because you have 9 months of like this human growing inside you. And then you have however many months of like this human who won't be put down.
Right. Yeah. It's a lot of touching.
Right. Right. But I wish someone would have told me that like that stage ends.
Yeah.
So like it's a lot now. And in my opinion, I think I had a harder postpartum period than a pregnancy.
Interesting.
Hmm.
Wonder how many people would say that. I feel like mine are so even, I don't know. I mean, it was almost harder for me maybe postpartum because I felt so responsible and I couldn't figure it out.
Hmm.
And it felt like I was like, quote unquote, ruining this baby's life because I couldn't figure it out. Like that's like a lot of the thought patterns that I had. And that like if she had any other mom, like she would be doing better and she wouldn't be like this. Like it was like sometimes I actually have a note on my phone from my first therapist who made me write down a lot of the negative thoughts I had, and then we were going to talk about reversing them. And I remember even going back, I read it and I'm like, these are terrible. And I remember even like erasing how terrible they were and trying to lighten them a little bit before I even got there. And I'm like, oh my gosh, I can't even remember what the like originals were. But it is, and I always try to like, I'm like, I never want to really scare anybody, I guess, with it all. But you also just kind of want to be realistic and say like, um, you know that potentially this is coming maybe. Like, is there like a good way to talk about that? Do you know like, or do you have any advice around that?
I think that for me, what helped was fixing those thought patterns before I got pregnant. And when I say fix, it's not like you never criticize yourself or never feel down, but like so many women I know beat themselves up over and over and over. And that's something I'm super passionate about, is teaching women how to change how they look at themselves and how they process how they're thinking. Because if you can change those patterns ahead of time, you can prevent a lot of stress. Because I remember sitting there and Tobias was having a hard day, and my mother-in-law looked at me and she went, "You are a good mom, and stop beating yourself up." I could like cry thinking about it.
Yeah.
Because you need people in your life to tell you that. Do you know what I
Yeah.
mean?
Oh yeah, you do. Like because you have a hard time remembering that or even thinking that on the hard
Mhm.
days, and that was definitely something that was almost like, I can't even say it because I might create it one day, but that was like similar to what I wanted to make at first, were like positive affirmations that you would just almost like have around your house or like in spots that you wouldn't expect, so that you could do that for yourself instead of necessarily if you didn't have somebody there to kind of do that for you.
Right.
Because I think it's really, especially if you are a words of affirmation, like love language. I talk about love language in the book because I'm like, there's just a lot that you feel like you're giving, 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 and not necessarily receiving, especially when a baby's like crying at you all day long. So
Right.
it's important to kind of honor like who you are still, and trying to communicate to your partner to like, this is how I like to be loved. Can you please make sure I'm feeling loved during this time too? Um,
Right.
because it is important.
And
Um,
I think setting up things in the postpartum period to help you heal is really important. Like I remember getting multiple chiropractic adjustments, multiple massages. This time around, I'm definitely going to get acupuncture
mhm.
because that was super helpful. So just therapy sessions, like anything like that, that is going to help you relax and unwind and remind
And
yourself like you're
being like
human.
kind of, yeah, like you're taking care of you, and like you are still you, like you're
Hmm.
not just like I'm still Kate, I'm mom Kate, but I'm also Kate. Like I
Right.
think that is really key.
Right.
So I think we would be like remiss to not talk about like postpartum depression, anxiety, and as you mentioned, the psychosis. And also I was reading a lot about like the postpartum OCD, which I actually think I had for a bit. um, but why don't you talk about like the postpartum depression, anxiety, maybe just letting people like moms kind of know a little bit more, maybe symptom wise, or just how they might know that it is something that they need, or do you use that kind of like or like the 3 day, do you kind of like use that as the barometer?
So, um, generally, when we're looking at depression, the general symptoms we use, you're feeling hopeless, helpless, worthless. You may or may not have suicidal thoughts. When we have postpartum psychosis, that's a lot of times where you hear stories of like women who kill their babies because you're not in your right mind. Does that make sense?
Yeah.
Like the mental health symptoms are so bad that you aren't yourself.
Right.
Like,
um
so
I mean, there's like a famous TED talk, I think, of a woman who went through that. I watched that and realized, like, oh my goodness, like this is something we have to talk about. Like, women can't be going through this.
Right. And it's very scary and it's very serious. And if you don't get help, like you could hurt yourself, you could hurt your baby. And again, I want to make sure we're clear here. We're not blaming, but we're
Yeah.
saying you have to watch for this.
Right.
If you don't, it can get really, really bad. Do you know what I mean? It's like if you leave an infection untreated, if you catch it early, you can get the antibiotics, you can take care of it, we're good. If you
Right.
don't catch this early, it can get really, really bad. So hearing things, seeing things, believing like a delusion, like, oh, I have to kill my baby
Okay,
or
I have
have
a
to do something
question.
like that. Yeah, go ahead.
Because this is one of those things where I was like, is this my anxiety? Is this what all moms go through? I would have a lot, I called them like phantom cries, or just like waking up like panicked, like like I would hear her like screaming, and I'd be looking at the monitor, and like she would be sleeping,
Mm-hmm.
and I would hear her like screaming, crying in my head, and it was like this battle of like, am I seeing things? What's happening? Like, is that normal? Like, does everybody go through that, or was that like part of my
I,
crazy?
I would think that's more in the realm of anxiety. Do you know what I mean? Because
Yeah,
that,
but that, so that's like the postpartum anxiety. That's not like every
right.
mom like hears that.
No, I wouldn't say that's like a
Okay.
psychosis or something like that. No.
Right.
So hallucinations or delusions are more like a fixed belief of like, if I don't do this, this is going to happen. Do
Oh
you know
yeah,
what I
I
mean?
definitely
Does
had
it,
that too.
it's not logical, but it's
Right.
just something you believe, and you can't really argue with someone who has a delusion. So,
Yeah.
and again, these are severe cases, but again, if you don't catch it early, it can progress into this.
Right.
So hallucinations or delusions, you're not sleeping. Sometimes people who are depressed are sleeping all the time though as well. So
Mhm.
I would say like a mom who sleeps all day and like can't get out of bed and can't take care of the baby. That's another big warning sign. Do you know what I
Right.
mean?
Hmm.
Um, like I said, you may or may not have suicidal thoughts or thoughts of self-harm, and your motivation is going to be really low. You're going to feel hopeless, helpless, worthless, not want to do much of anything. So those are the general signs of depression that I would look for. And then in the postpartum period specifically, I would look for crying all the time. Not like there are a few days in there where like you're going to cry because your hormones are shifting and that's normal. I'm talking like crying all the time or a significant portion of the
I'd
day, I
say
should.
like once a day. Like I used to cry. I mean, I used to cry a lot.
But how long did that go on for?
A long time. The whole time I nursed.
Okay.
It was a huge source of anxiety, and just I feel like I had that like when I would let down, I would like get depressed. Like it
Mhm.
would like not be like I don't feel like I ever got the oxytocin from the
Mhm.
nursing.
Well, and I would say that's a warning sign. You know what I mean? Like
Yeah.
when you get outside of like a week to 2 weeks, if you're still crying a bunch,
Oh yeah. Oh
you know.
gosh, the first 3 months, like literally.
Hmm.
3 months, like I would have, and where it would be like almost extremes. Like be
Hmm.
with my family, I'd be happy, and then I'd get home and I'd be like so sad. Like here I am with this baby I can't take care of, like, and just like overwhelmed to the extreme. Which I do feel like I had way more of the postpartum anxiety.
Hmm.
But it was almost like then I would crash and have like a depressive state for like a day or two, or like a moment or whatever, and then it would go back, like shift back to the anxiety.
Right. And they really are very closely related. I don't know that you can fully separate the two of them,
I
honestly.
don't really think so either, especially in that phase of life.
Mhm.
Like I really think it's like it just being so alone and with like your baby and trying to learn them, like I
Mhm.
just feel like that's naturally going to lend itself towards some depression, especially if you weren't doing that before.
And I think too, like a lot of people have depression and anxiety prior to pregnancy. Do you know
Yeah.
what I mean? And so that
Yeah.
needs to be a discussion of, I think for a long time, people were like, oh, you can't be on meds when you're pregnant. And it's like, but research has actually shown us that untreated depression in pregnancy actually affects the fetus.
Mm,
You know what I mean? So there's
interesting.
not there's not an easy way out of this. If you
Yeah.
have depression and anxiety, it deserves to be treated even during pregnancy. Will
Like
meds
you
be
deserve it for
impacted?
it to be treated. Like I think that's kind of one thing is I was feeling like I was almost doing it to myself. Like it was like something that I was like allowing to happen.
Mm,
Um, and like then I kind of started, then I like had to shift that and I'd be like, this is like happening to me. I'm not causing it. You know, I can learn how to cope with this. I can, like you said, have coping strategies. I can try different things. And so especially for me, I feel like writing, just like seeing it in black and white and being like, oh my gosh, this is what I keep telling myself. And like, I would never say this to anybody else. That's really like one of the things that kind of like snapped me to like the logical side of my brain, where it was like not just swirling in my head over and over again.
mm-hmm. Yeah, exactly. And really having support and help to identify when you're falling into those patterns is really critical.
Yeah, that's one of the biggest things I have at the beginning, like the support and postpartum plan, like who is taking care of you? Like,
Mm-hmm.
and it's not you. It needs to be somebody else. And just being okay with that, especially I feel like you're probably like me, like I'm really independent. I don't want to rely on anybody else. Like the thought of like saying to somebody else, like, you have to take care of me is like, I don't even want those words to come out of my mouth, but that's what I wish I would have done.
Yeah.
And I said to my grandma, because she always says to me, we didn't know how bad it was and like all this. I'm like, because I tried to hold it together. And like if you
Mm-hmm.
try to hold it together, people are going to think you have it together, you know. If you let yourself unravel a little bit to people you trust, I'm not saying you have to walk around and like let everybody see you crying all the time, but
Mm-hmm.
it's just like have those people who you do trust, who you will open up to and be honest with, because I think that's like so important. How so I don't know if you really like work with postpartum women or if that's like you can say this. I asked my therapist this too, like how common do you think it is? Because I think I heard that it's like 1 in 7 or 15-ish% or
I think it's higher than that.
I
I
think
don't
it's so
have,
much higher.
yeah, I don't have statistics to back that up, but
Yeah,
I do.
she said the same thing.
Yeah, I mean, there's so much underreporting that goes on, and it's a very vulnerable time
Hmm.
because I think a lot of women are scared that, like, if they share that they're struggling, that, like, I'm going to get my baby taken away. Do you know what I mean? Like, there's so
So I
much
wrote that in the
fear.
book. I
Mm-hmm.
said, you are just the only person who really sees you in those first 6 weeks is the pediatrician. And
Mm-hmm.
like most of the time, unless you've had children before, like you don't really know your pediatrician. So like, are you going to sit there and tell them like that you're really struggling or you like, I don't remember feeling that necessarily with ours, but that's because she's like a 65-year-old. She has seen everything. She comes in and gives me a hug every time she sees me. Like she is like a mother, like she's very motherly. But then there was a guy who walked in one time when we had like a stop in, and I was like, I sure as heck wasn't telling him what was going on, you know,
Right,
like,
right.
so I think there's that component to it, like how much do you really trust the pediatrician to be open with? Um,
That's why I think, like, having a therapist and having a mental health professional who can really look and go, it's bad right now, and, like, you need to go to the hospital, or you need, do you know what I mean? Like,
mhm.
they're not going to take your baby away from you.
Right.
Like,
They're trying to help
objectively,
you too.
they're trying
Yeah.
to keep you safe and baby safe. Do you know what I
Right.
mean?
Yeah.
And unless there's, like, drug use involved, which that's another issue. Like, some moms, have other mental health issues. And so with that, you need to have a team at the beginning of pregnancy, because if you have people who are invested in you and care about you and are willing to work with you, and you're transparent through the whole thing, most of the time it's okay. Do you know what I mean?
Right.
It's the people who try to hide the problem and cover it up and not talk about it that
Right.
they get caught, they get stuck, and then it kind of spirals. You know what I mean?
Totally. Yeah, that makes a lot of sense.
But everyone's entitled to mental health treatment. Um,
So
and to
I
your
just have a
mom.
question because I've always wondered this too. What does it mean to be reported?
So a lot of moms, if, like, when they go to give birth, the baby's umbilical cord can be tested for drug levels.
Okay.
So that's kind of what it would mean. Like, if the mom's positive or the baby's positive,
Yeah.
that's kind of a situation where the baby would theoretically get taken away. Do you know what I mean? Or if the mom's
Yeah.
in legal trouble prior to that. Whereas if you have a mom who, like, is transparent and is working on getting help and working with a treatment team and is being compliant and following through with things, like even if there was drug use through that, like the odds of them losing their baby are much less.
Right. Gotcha. Yeah. Yeah. Um, awesome. Well, yeah, I think that the mental health piece of motherhood is just, it's just what we all need to talk about a little bit more. I think we all, hopefully this community group becomes that for some people, even if it's just reaching out in private to one another. Like it just, you have to open up to somebody. I think everybody talks about like, mom bee or, mom life. I mean, I even have like the shirt that says mom life, but sometimes I just think about it and I'm just like, I think we're almost kind of making a joke about some of like the really serious issues, and we're not getting it now, and so just hopefully just talking about it a little more. And I'm guilty as the next one of being like making the jokes and stuff, because you need a little humor to survive sometimes too, but it's just
Right.
like also recognizing that it is really important and something that we need to focus on. So tell everybody in the group a little bit more about how they connect with you, what you offer, because I'm sure they're going to be like, okay, I need to hear more. Maybe they're struggling a bit themselves. Like, what would you give as advice for them too?
So my website is shelbyleppin.com. You can find all my services there. I offer a couple different things. Again, my passion is really teaching women how to change the thought patterns around how they talk to themselves and how they view themselves, because I think that is a key component for mental health. So I have a course called the Brain and Body Bliss. It focuses on weight loss a little bit, but I really, my primary objective isn't weight loss. And if you look more into it, you'll kind of see that it really is, if you can treat the mental health underneath, then a lot of times the weight really isn't the biggest issue.
I have to tell you, I 100% agree with that, because I started out in nutrition and it was like, this is how I've gotten here, because like nutrition is not the answer. It's the
Mhm.
mental health piece that's the answer. Yeah.
Right, right. And not to say like, yes, nutrition is important and we need to
Mm-hmm.
be healthy, but like if you get the mental health piece down, the other stuff really quickly
Just
falls.
falls into place. Yeah.
Yeah, so that's, I offer a course, and then I also do one-on-one coaching. And this is for people who you want someone to like walk you through every step, because I have 5 kids and I work,
So many
I
kids.
have a business. Yes. So I basically will teach you all the things that I've learned over the past few years. And so instead of having to take years to learn them, I will make an individualized plan to help teach you coping skills, strategies to keep up with your home, strategies to keep up with your kids, manage
So
your stress.
awesome.
It's a full wellness program, and I really enjoy it a lot because I enjoy the personalized preventative side of
Mhm.
things. And then I also see patients in this local area if you're in Kirksville, Missouri.
Awesome. I love it all. That's so amazing. So I hope you all take the time to reach out to Shelby, even just letting her know if this video impacted you and anything resonated. I'm sure she would love to hear it, as we all do when we own businesses and we're working so hard to put out content. So thank you so much for being part of this. I truly could not appreciate it more. And I thought this was a great discussion.
Oh, it's so
Wait,
much
tell them
fun.
about your podcast too.
Oh, yes. I have a podcast called the Rooted Mind Podcast. You can, if you follow me on Instagram, it's at Shelby Leppin _renew. You'll kind of get updates on the podcast and everything that's going on. But yes, we talk about nutrition and mental health, and we try to bridge the gap between the two.
Yes, it's a really great show. So I hope all of you, because I know that you all need, to feel like you're talking to somebody throughout the day. So I love podcasts for that reason. And just make sure you tune into Shelby's. Well, thank you so much for being here.
Thanks, Kate.
All right. And I hope you guys have a great day.